Hi, I'm Cody Peterberg, and I will be doing mobility impairment. Mobility impairments can be due to an accident causing loss of movement to one or more limbs or removal of a limb, genetic conditions or illness, atrophy, and age. Examples of mobility impairments are listed here. It is a challenge for those with mobility impairments to get from one location to another, which can lead to reduced participation in the community and social life, missed doctor appointments, inability to complete activities of daily living, falls, pressure sores, contractures, and/or the need for income or in-home caretakers or to be placed in a living center. Transportation, as well as physically being able to get themselves ready, is a huge challenge for the mobility impaired population. Can they get themselves there, or do they need to rely on someone else? Is there access to public transportation? Do they have money to pay for gas or transportation? The Utah Department of Health stated people with disabilities are more likely to engage in unhealthy behaviors like inactivity and tobacco usage and experience a higher incidence of chronic health conditions like diabetes and obesity. Cache County is included in the Bear River statistic along with Rich and Box Elder County. Bear River's mobility disability is rated at 9.1%, whereas the top four health districts are Southeast Utah at 14.9%, Tooele County at 13.1%, Central Utah at 13%, and Tri-County at 12.5%. Statewide, most common are mobility-related disabilities at 9.1%. Utah Department of Health stated Utahns with disabilities are more likely to be female, Native American, or Alaska Native and live in the Central Utah, Southeast Utah, Tooele County, or Tri-County local health districts, more likely to report lower education and income levels as well as a lack of health insurance. The CDC in 2019 compared adults with mobility disabilities to the U.S. In Utah was 9.6%, and the U.S. percentage was 12.9%. They identified mobility disability as serious difficulty walking or climbing stairs. The World Bank identified that 15% of the world's population, 1 billion people, have some form of disability in 2019. Utah has a smaller than the national population. In 2016, the state with the lowest percentage of its population having a disability was Utah, 9.9%. The state with the highest percentage of disability was West Virginia, and was more than twice as high with a percentage of 20.1%. The World Health Organization in 2011 stated, while the prevalence data in this report draw on the best available global data sets, they are not definitive estimates. There is an urgent need for more robust, comparable, and complete data collection. Generally, a better knowledge base is required on the prevalence, nature, and extent of disability, both at a national level where policies are designed and implemented, but also in a globally comparable manner, with changes monitored over time. And what factors play a role? Individuals with disabilities are more likely to be inactive, have high blood pressure, smoke, and be obese, stated the CDC in 2019. In my experience, I have lived in Idaho and Utah, which I could see a comparable difference between what was available in Utah compared to Idaho. Utah had more healthcare opportunities, such as home health agencies for adults and especially children or pediatric patients, more assisted living centers or skilled nursing homes, and hospital services, and larger hospitals located in Salt Lake City. Factors that contributed were availability of resources to meet daily needs. Are they able to work for an income, or do they need state assistance? Can they care for themselves, or do they need a caretaker? How will they pay for a caretaker? Do they need a basic wheelchair or a motorized wheelchair? Can they get themselves in and out of the wheelchair? Are they capable of using the wheelchair, or do they need assistance to move about? Can they eat, or do they need someone to cook for them, or will they need to be fed with a gastrointestinal or jejunal tube? Access to education, economic, and job opportunities. Are they able to work but need help getting there? Are they able to go to school, or do they need an aide or nurse with them? Access to health healthcare services, and transportation. Are they able to get themselves there? Can they have their car adapted to drive with their hands? Do they need someone to drive them because they cannot physically and/or mentally do it themselves? Is the doctor or hospital nearby? Do they need to plan for an all-day trip to make it there? Are they able to understand when given results, diagnostics, and/or educational teaching? Do they need someone there to help them understand and carry out the plan? If yes, will there be somebody available to go to all appointments? Social support and community-based resources. Do they have a good family support to help them accomplish their tasks? Are there a few people they can count on so they do not feel that they are a burden? Are there mobility impaired adaptable recreational activities available? Are there therapists and counselors available to help them with the mental side of having a disability and relying on others? Language. Are there programs available and monetary help to obtain programs to help them speak if they are unable to? When I worked pediatric home care, I worked with a child that had a mobility impairment and seizure disorder. He was able to answer yes and no questions by turning his head to one side, meaning yes, and the other meaning no. However, but at the end of my career there, he was starting to use Eagle Eyes, which is a program where we put electrodes on his forehead and he's able to control the computer mouse to do activities on the computer. This would be awesome to see the different programs that are available to help with language and or other activities of daily living. Access to mass media and emerging technologies. Are they mentally capable of understanding and using media or technology? Is there technology available to make their life and their family's life easier? If they are able to use and understand media and technology, what devices are available to make it easier for them? The built environment. Are the buildings such as grocery stores, banks, shopping stores, restaurants, work, schools, recreational settings, and housing, sidewalks, and public transportation wheelchair accessible? The physical factors that are affected or affect this population are the built environment, such as the buildings that are already there. Are they wheelchair accessible? Are they set up so that those that have mobility impairments are able to use them and utilize them well? What about the extreme weather or other emergency situations? Are there plans in place that they can be able to be safe in these situations, and do they have somebody to rely on in these situations? Psychosocial. Are they isolated, depressed, anxious, or feel inadequacy? Oftentimes, they may be going through a huge life change, especially with those that are quadriplegic or paraplegic or lose a limb due to an accident. They may dwell on what their life was before, and we've got to be there to assist them in overcoming that. Economic. Do they have access to the environment once again, or do they have to spend money? Does the community have to spend money on these structures to change them to allow them to be wheelchair accessible? Are there ABLE accounts in place to help them save for future needs and administered by the states? Do they know about these that are available? Social. Are they living in poverty? Are they able to meet their basic needs and obtain their different emergency or medical equipment? Do they live in a lower educational attainment group? Are they able to attain or are they able to go to school and attain a degree at the university? Are they wheelchair accessible that they can do those things? And then here is the root cause. Contributing factors. So I based this one on different populations. In my mind, I focused on those that have a medical condition such as cerebral palsy, seizure disorders, meningitis, hypotonia, especially in children because of my interaction with pediatric home care. Therefore, in order to meet the first tier within this population, a caregiver is often needed to help meet those needs. Parents or guardians need to assist with gastrointestinal feedings and water intake. Sometimes breathing is assisted by a ventilator or tracheostomy. Excretions are uncontrolled and need help from those around them. Homeostasis is controlled with assistance from external factors, and sleep is needed to help protect and heal their bodies. More likely than not, sex needs will not be met. The safety tier is met with assistance of the parent or guardian as well. Resources and health are the main safety needs met. I believe that in most cases of mobility impairment of children affected from birth or a few months old have unmet safety needs such as employment, morality, property, and the family. Love and belonging is often met because the parents and the siblings love the special needs child dearly, but sexual intimacy needs are unmet. Esteem and self-actualization are also very rarely met if the child is physically and mentally impaired. However, when I think of the couple I recently cared for in the hospital, these needs are met in a very different way. Both the husband and the wife are paraplegics and get around in motorized wheelchairs. They are in their 50s and have learned to deal with and overcome many obstacles. Physiologically, their needs are met with minimal hassle. They can breathe without difficulty, obtain food and water, sleep, maintain homeostasis, and excrete with minimal assistance. However, I'm not sure about their sex needs. The safety tier is a little more difficult, but they both have a job, family support, and own a house. Resources are harder to come by because the wife needs catheters to expel urine, and if the doctor is not one in town, they need to go together because the husband is the only one who drives, or they need to have someone else take them. I believe esteem would take time and work to meet those needs. However, they seem to have confidence and good self-esteem, are amazed with themselves and others' achievements and respect others. I think respect by others would depend on where they are in the world. Here in our community, they are well known and respected. Self-actualization needs may be met some days and unmet others, depending on life, in my opinion. Morality, creativity, problem-solving, and acceptance of facts would be met during high times and more difficult to meet in low times of life. I think spontaneity would be more difficult because you have to think about how to get there and ensure you have supplies to take with. Catheters and battery for the motorized scooter would make spontaneity difficult. Lack of prejudice would also come and go as you interact with different ages, cultures, and races. The anticipated functional level. Those with mental and physical disabilities would most likely function at the physiological tier. Those with mobility impairments but not mental impairments would function between love, belonging, and self-actualization, depending on hardships in life at the time. Likely health outcomes. I believe that those with mental disabilities have a good chance of being healthy because they can interact with others and adapt to life in a wheelchair. However, those that were not always in a wheelchair may not see themselves as able to conquer the world and have more depression, anxiety, and have poor health outcomes. Those with mental and physical disabilities must rely on family and caretakers to watch for signs and symptoms of illnesses. I believe they have a good chance at having good health outcomes. On the other end of the spectrum, families do get burnt out, and in those cases, mentally and physically disabled individuals have poor outcomes of health. Are they at a higher risk for communicable diseases? Yes, especially kiddos with trachs, vents, and other autoimmune diseases, along with being immobile. They are at high risk for catching colds and flus that can turn into pneumonia. Ensure they are well rested, eat healthy, and receive vaccines and shots as appropriate. When others that are sick, ensure that good hand hygiene and remind the others about proper respiratory etiquette. However, yes, on the other end, because they are unable to move around as much, which can cause pneumonia to develop easily. Ensure they are well rested, eat healthy, and receive vaccines and shots as appropriate. When around others that are sick, ensure good hand hygiene and remind the others about proper respiratory etiquette. Are they at a higher risk for non-communicable diseases? Yes. Those with mobility impairments have a harder time getting exercise. It is important to teach them or their guardians exercises they can do at home, physical therapy options that are available, and teaching and education about what to watch for and when to call the doctor to prevent non-communicable diseases.